Welcome back, my good people, and it's good to see you back in this particular channel. And I'm very happy that you've clicked this video now that we are going to learn about stage 4 of HIV clinical staging by WHO. Remember, we had discussed about stage 1, 2 and stage 3 in our previous videos, and if you have not watch those particular videos, they may appear up here or even in the description below. Kindly click them, watch them so that you are well conversant with that particular and in stage 4 now, this is where your body's immune system has really depreciated and has gone down, and this is where we find most of the severe opportunistic infection and even cancers are setting in this particular stage. And this is the reason why we say that we must look into this into details, because even if we do CD4 counts, it has dropped drastically below 200 cells, and this means that your immune system has been weakened. Now, this is where we call AIDS defining illness. This is full-blown AIDS, particularly those who have not started antiretroviral therapy. We normally tell you that if you've been tested, start antiretroviral therapy straight away when you've been confirmed that you are HIV positive. Now let's dive in and discuss this one by one. And if you have not subscribed to this particular channel, my friend, you are missing a lot. Click the notification bell written subscribe, turn it on for every video that I will post. And this particular channel is important for all health professionals, and even students can really learn a lot from this particular channel. Now let's dive in. And the number one consideration in this particular staging is that we have what we call HIV wasting syndrome. This occurs when an HIV patient loses more than 10% of the body weight, accompanied by chronic weakness and even diarrhea for over 1 month. And it is a result from a combination of poor appetite, chronic infection and metabolic changes, and this normally affects your entire body. If you look at this particular patient appears thin and is literally wasting away because the body cannot absorb its nutrients or even utilize its nutrients properly. So it is very important to look at your body weight, and if you are presenting with all those I've mentioned, then that is HIV waste. Now we have a particular pneumonia which is very important. We call it Pneumocystis jiroveci pneumonia. Pneumocystic jiroveci pneumonia, PCP. And note that this is a fungal infection caused by Pneumocystis jiroveci. We used to call it carinae, but nowadays it's Pneumocystis jiroveci. And some patients will present with the shortness of breath. You can't breathe very well. Sometimes you normally develop cough, and the oxygen concentration in your body has really gone down. You present with hypoxia, and this particular patient, even if you do an x-ray, sometimes it's very normal. And this is the one most common cause of severe pneumonia in advanced HIV. So we must take it keenly when the patient is presenting with those 3 symptoms that I've mentioned. And normally at this particular stage, we only give prophylaxis called cotrimoxazole, the so-called Seprin, so that it can do away with this. And in this scenario, we still have another pneumonia which is normally recurring, that is we call recurrent severe bacterial pneumonia. Now in patient, if a patient present with 2 or more episodes of bacterial pneumonia within 1 year, it suggests that there is an immune collapse. There's something that we can do about this. And the candidates that are very prominent and very prone to attack this particular patient, these bacteria are Streptococcus pneumoniae and Haemophilus influenza. These are the most to the topmost bacteria, and this one shows that the body defense system has really gone down, so the opportunistic infections are being invited in this particular state. The fourth one is this patient will present with a type of meningitis, and this one we call cryptococcal meningitis, and this is a fungal infection attacking your brain. It's caused by a fungal fungus called Cryptococcus neoformans. And this particular patient present very funnily. You might even think they have malaria, but they do not have malaria because they have headache. But this headache is very severe. Their neck is normally stiff. We call it nuchal rigidity. Sometimes they vomit. And the very important thing to know, there's confusion. This patient cannot even think well. This patient sometimes can even convulse. So the diagnosis is being made by analyzing the CSF fluid. We do lumbar puncture and cryptococcal antigen test, sometimes called the serum crag, and this is medical emergency that needs antifungal therapy, and we normally use amphotericin B, which we normally give, and then maybe we discharge them on fluconazole. So it's very important to consider when a patient is presenting with headache, stiff neck, and even vomiting combined with confusion. And this one can also be presenting more or less than the number 5 toxoplasma of the brain. This is so bad. It's caused by an organism called Toxoplasma gondii, or some people call it Toxoplasma GONDI. It depends on who taught you who taught you in college and how he was mentioning. So our lecturer used to mention is Toxoplasma gondii. So this is an infection that leads to brain abscess and neurological symptoms like seizures. You can convulse, you get confused, and the worst of it, it can bring paralysis. So how can we know this? We go ahead and do CT scan or even MRI, which normally shows atypical ring enhancing lesions, and treatment involves pyrimethamine and sulfonamide. So take note of this Toxoplasma gondii, which normally affects now brain. We have number 6, which is called chronic herpes simplex infection. Chronic herpes simplex infection. Remember in stage 2 we talked about herpes zoster, but now this is chronic herpes simplex infection. The herpes normally causes painful oral, genital, or even in your anus. In your anus, it causes ulcers that may last more than a month, and it's considered as stage 4 illness. This is the virus now persists in your system due to poor immunity, and the lesions can become more deep, and healing can be a very big problem. So that's why we need you to start antiretroviral very fast when you've been diagnosed about this. We mentioned something about cancers. Now, number 7. There's something we mentioned something about cancers. Now, number 7. There's something we call Kaposi sarcoma. Kaposi sarcoma. This is a cancer of blood vessels. It's a cancer that is linked to human herpes virus type 8. Type 8. Patients normally present with purplish, dark lesions on the skin, even in the mouth, or even internal organs. And if you look at the hard palate, somewhere here, you will see them very well, even on the skin, the dark purplish lesions on the skin all over. And this is a classical age-defining cancer, and treatment include antiretroviral therapy, which is very key, and chemotherapy. And if it's extensive, this is where we use belomansin, vincristine, all those cancer drugs that are used to treat Kaposi sarcoma. So we normally call it KS. So it's very important to note that. Number 8, there's what we call HIV encephalopathy. If you If you hear this, this is something which is causing what we call dementia complex. Dementia complex. It's due to direct HIV infection to the brain. Now, remember, if something is attacking your brain, you will get confused, you will lose your memory, you will even lose your motor coordination. Even your mouth can be deviated, you cannot even see well, you will be trembling. Even if you hold something, you will be shaking like somebody who has fever. Or like somebody who has Parkinsonism. So this is not Parkinsonism, but this is now HIV encephalopathy that is attacking your brain directly. So treatment is antiretroviral therapy, and managing it is by case, how the patient will present and how the CT scan of an MRI will show up. Extrapulmonary tuberculosis is number 9. Remember, we talked about stage 3 tuberculosis, that is pulmonary tuberculosis. This is now extra, when TB spreads beyond the lungs, like lymph nodes. We call this TB adenitis. You will find that some people have things that are swelling here. Those are lymph nodes. It can attack your bone. You've heard about TB spine, about disease, the TB of the spine. It can even attack your brain, TB meningitis. And this is what we call extrapulmonary TB, and management is not easy. You will take anti-TBs for longer time, and you will also be continuing with antiretroviral therapy, and this needs longer treatment. And this normally confirms to us that there is advanced immunosuppression. So that is why antiretroviral therapy. Number 10, we have something called cryptosporidiosis or isosporiasis, sometimes called isosporiasis. These are protozoas infection that cause chronic watery diarrhea for more than 1 month. Sometimes you admit a patient with diarrhea, you give loperamide, still diarrhea, you give IV fluid, Ringer's lactate, diarrhea cannot stop, until you investigate what type of organism is causing this diarrhea. First do the test, confirm there is HIV, then think of cryptosporidiosis and isosporiasis. Now there is dehydration and weight loss are common, and these are the patients that are very, very wasted. They are very thin. So if you don't start antiretroviral very early and rehydrate this particular patient, you may lose this patient because of electrolytes imbalance. So if you are a student watching this, kindly note this. Now, number 11, we have what we call disseminated fungal and mycobacterial infection. This includes cytomegalovirus, histoplasmosis, disseminated non-tuberculous mycobacteria infections. These affect multiple organs like blood, bone marrow, liver, spleen, and it indicates very low immunity. So you will note that as an opportunistic, what we call CMV, cytomegalovirus of retinitis, affecting your retina. And this is a viral infection that damages your retina, and it may lead to blurred vision, even total blindness. When we do fundoscopy, it shows pizza pie. I know some of you like pizza. So the fundoscopy shows something called pizza pie appearance, and there are areas of bleeding and necrosis that are visible when you do fundoscopy, that when you check the eye. Then urgent antiretroviral therapy is needed to prevent, of course. Now, number 13, we have what we call progressive multifocal leukoencephalopathy. This is caused by JC virus, leads to progressive brain damage. You know, HIV in stage 4 is now damaging your brain with weakness, slurred speech, you have speech problems, there's visual loss, there's incoordination, your motor functions goes down. So without ART management, this may be fatal when you don't do ART, but may improve once the immune system recovers. Meaning, when you start antiretroviral therapy, then things may go well to this particular patient. Now, this one normally affects a lot of patients in stage 4. Candidiasis of esophagus or airways. That's called esophageal candidiasis in short. Now, we had candida in the previous stages we were discussing, but now this is affecting your throats and esophagus going towards even the trachea, and this one brings painful swallowing. And if you visualize with your pen torch like this and look at the throat, you will see those white patches all over. And when a patient reaches this stage, even they refuse to eat because of the pain. So in this particular scenario, we do antifungals and continue antiretroviral therapy. Period. Case closed. Patient managed very well. Number 15, we have non-typhoidal Salmonella septicemia. We have this is Salmonella typhi. That is a recurrent bacterial bloodstream infection with Salmonella occur due to loss of immune system. Your immune goes down, and what will happen? Patient will develop fever, they will develop chills, they will develop diarrhea. So there are antibiotics we use for this, and of course we continue doing what we call lymphomas. Coming into number 16, HIV patient may develop beta cells or cerebral non-Hodgkin's lymphoma presenting with swellings, weight loss, and neurological problems. Most of stage 4 is affecting the brain. These are cancers. I talked about cancer and strongly linked to immune failures, and as you can see in those diagrams I'm presenting, those are our lymphomas. Cancer of the cervix. This now affect our ladies, and I, as a representative of county working at county referral in chronic care centers, we normally screen women who are taking antiretroviral therapy. It is a must. We must screen you. If you refuse, we give you psychological preparation, we give you a shorter duration. You come when you are prepared. We do this because of what we call human papilloma virus. This is an invasive cancer causing AIDS-defining illness in women, and that's why we encourage the injection to our young ladies. And if you have not watched that video of HPV, kindly scroll in my video, even the description below. You will see how I've talked about human papilloma virus, even the cutoff where we give the immunization for this particular lady. So visceral leishmaniasis, this is called Kala-Azar. It's a parasitic infection causing fever. When your spleen enlarges, that's what we call splenomegaly, and also leading to anemia. This is due to severe HIV, and your immune system goes down due to poor response. Particularly, maybe you are taking ART, you've left, and now visceral leishmania has attacked you. Now, number 19, which may be last, it may be the last in presentation, but not the least. These are organs complications of chronic HIV infection. That is now HIV-associated nephropathy attacking your kidneys and cardiomyopathy attacking your heart. So the organs are attacked due to complication, a long-term complication of HIV, and one may lead to kidney failure or heart muscle weakness. So these patients, we must do kidney function tests. Most of them, remember the drugs that they are using, the first line, the tenofovir, lamivudine, and dolutegravir, tenofovir versus kidney. So we must do kidney function test before we initiate you to this particular drug. So if you have not started this drug very, very early, so without ART, you might even develop hypertension or even CCF. Cardiac failures can set in. Worst of all, end stage kidney failure. What are my closing remarks? That in stage 4, it's the most severe stage of HIV infection, marking what we call AIDS acquired immunodeficiency syndrome. But remember, with early diagnosis, antiretroviral therapy adherence, and proper care, patient can still live long and with a productive life. In my clinic, we have those who started, those who were initiated on ART more than 30 years ago, and they are still alive. That one means when I was still in kindergarten. So if you find this video very, very helpful, please like, share, and subscribe to this particular channel. And kindly drop your comments below, because I would like to hear more about what you feel about this video. And if you have not watched HIV stage 1 and 2, it might be appearing up here. Stage 3 might be appearing up here. Muchas gracias. See you in the next video.